The shoulder joint moves in lots of different planes and axes, therefore allows lots of different movement types. The first movement type we'll be looking at is flexion. And the agonist which allows flexion is the anterior deltoid, which originates from the clavicle and the scapula. The insertion point is the deltoid and the tuberosity of humerus, and the antagonist is the latimus dorsi. The shoulder joint also allows extension. The agonist when extending the joint is the posterior deltoid, and its origin is still the clavicle and the scapula. The insertion point is at the humerus, and the antagonist is still the latimus dorsi. The shoulder joint also allows abduction. The shoulder joint also allows adduction, medial rotation, and extension. This all happens at the agonist of the latimus dorsi, and the origin is the lumbar ilium and thoracic vertebrae. The insertion is yet still at the humerus, and the antagonist is the deltoid. The radio-ulnar elbow and knee joint. First off, we have the radio-ulnar. Its main movement is to supinate the forearm, and its agonist is the supinators. The origin is the lateral epicondyle of humerus, and its insertion is the lateral proximal radial shaft, and its antagonist is the pronator teres. Its other movement type is pronation of the forearm. Its agonist is the pronator teres, and the origin is the medial supracondylar ridge of humerus. Its insertion is the middle of the lateral surface of the body of the radius, and its antagonist is the supinators. Now we move on to the elbow joint, and the elbow only allows flexion and extension. As the elbow flexes, the agonist is the biceps brachii, and the origin is the scapula. The antagonist, however, is the triceps brachii. As we know, the muscles work in pairs, and they are usually opposite each other. Its insertion is the radial tuberosity. And lastly, we have the knee joint, which allows flexion of the knee and extension of the hip. During this movement, the agonist is the hamstrings, and the origin is the tuberosity of the ischium. Because the agonist is the hamstrings, then we can expect the antagonist to be the quadriceps of flexion of the knee and extension of the hip. The insertion point is the tibia and fibula. The knee joint also allows knee extension and hip flexion, and quite rightly so. The agonist will be the quadriceps, and the antagonist would be the hamstrings, opposite to the movement, so it's the opposite in muscle groups. The origin, however, is different. It is the rectus femoris and vastus muscles, and the insertion is the tibial tuberosity. Now we are moving on to the hip joint, and as we can see, the hip joint allows quite a lot of movement. This is because it is a ball and socket joint, which is a synovial joint which allows lots of different movement types. First off, we have flexion at the hip, and the agonist is the ellipsois, therefore the antagonist is the gluteus maximus. The origin is the iliac fossa and lumbar spine, and the insertion is the lesser trochanter of femur. The hip joint also allows external extension and rotation. Again, this is pretty much opposite to the flexion in terms of agonist and antagonist. Therefore, the agonist is gluteus maximus and the antagonist is ellipsois. However, the origin in the external extension and rotation is the gluteal surface of ilium, lumbar fascia, sacrum sacrotuberous ligament. And the insertion is the gluteal tuberosity of femur and iliotibial tract. Another movement it is able to do is the hip joint also allows abduction and adduction. When the hip adducts, the agonist is the adductors and the origin is the pubis, insertion is the femur and tibia, and the antagonist is the gluteus medius and minimus. However, when the hip joint abducts, the agonist is the gluteus minimus and medius, whereas the antagonist now would be the adductors. The origin is the gluteal surface of ilium under the gluteus maximus, and insertion will be greater trochanter of the femur. The hip joint also allows dorsiflexion, and when the hip creates this movement, the agonist is the tibialis anterior, and the antagonist is the gastrocnemius and solus. The origin at this point would be the lateral surface of the tibia and the adjacent interosseous membrane, and the insertion would be the medial cuneiform and the base of the first metatarsal bone of the foot. The hip also allows plantarflexion, as it is opposite of dorsiflexion, so that we can expect them to hip joint to do both movements. Again, the agonist is opposite to dorsiflexion, so it's the gastrocnemius and solus, and the antagonist is the tibialis anterior. The origin is the lateral condyle of femur and medial condyle of femur, and the insertion is the Achilles tendon. As we move on to the spine, we can see that the movement is only allowed in 4 different ways. The first type of movement we will be looking at is the ipsilateral trunk rotation and compresses abdomen. The agonist is the internal obliques and the antagonist is the external obliques.